Welcome to Speak Up and Stay Alive Radio, how to survive hidden healthcare and hospital dangers with author, speaker, and your host, Pat Rulo. Pat has over 20 years experience as a professional public speaker, and for the next hour, she's going to be your healthcare and hospital survival guide. Each week, you will say, oh, as Pat exposes and explores little-known hospital hazards, delves into the deep waters of dangerous healthcare practices, picks the brains of her good-looking and influential guests, all guaranteed to keep you and your family safe in today's fragmented healthcare system. The Speak Up and Stay Alive radio program is intended to advance health literacy by making you aware of healthcare and hospital dangers. The program is for informational purposes only and is not intended for use as diagnosis or treatment of a health problem or as a substitute for consulting a licensed medical professional. Participating as a program listener, guest, or caller should not be considered medical advice. References to any entity, product, service, website, or source of information should not be considered as an endorsement. And now your host, Pat Rulo.
I can't bear it no more, baby. I got too much pride. But I'll survive.
Hello, I'm Pat Rulo, and I will be your hostess, your healthcare navigation hostess, where I will spend the next hour serving you a generous helping of everything you need to know to help you and your loved ones stay safe during any doctor or hospital visit. Who am I? I am you. I am every person who has ever been in a hospital or doctor's office and has received less than acceptable treatment. I am you. The person who got an infection during a simple outpatient procedure. I am you. The patient whose questions are ignored, who struggles to speak to the doctor as he or she has one foot out the door. I am the missed heart attack, the hospital-acquired infection, the wrong diagnosis, the unanswered call button. This show is about you, your family, your friends, and your loved ones. It's about becoming informed of all the hospital hazards, what they are, how and why they happen, and what you can do about them. This show is about empowerment. It's about doing everything you can to stay safe during any and every healthcare encounter. Speak Up and Stay Alive Radio, yes, that's OH with an exclamation point, will cause you to say, oh, as each week we delve into little-known hospital and healthcare dangers. When you understand why something happens, you are better equipped to do something to change it and prevent it from happening to you. If enough people begin to speak up together, each of us can alter the current precarious path of today's unsafe healthcare practices. Today's show is once again filled to the tippy top with so much life-saving information, not to mention fun, and we'll leave you adding lots of hand sanitizer to your shopping list. So find a comfortable position, sit back, and let our reassuring voices make you feel safe and cared for. But now, here's the healthcare hazard of the week. Thousands of people throughout the country are catching the flu. Thousands of people get the flu vaccine. People are even dying from this outbreak of not only influenza, but also the norovirus, a nasty bug that causes vomiting and diarrhea. Yet thousands of people are not doing the one simple, easy breezy thing that can help avoid these dangerous outcomes, and that would be hand washing. Yes, I know we talk about this on this show, but here is some up-to-date information that just might cause you to suds up a little longer. Hand hygiene is recognized by infection prevention and control experts as the single most important activity that you can do to decrease the spread of infection, both in and out of the hospital. Because the hands are the vehicle for transmission between people as well as environmental services, such as tabletops, phones, and so on, it is so important to practice frequent hand hygiene using good old-fashioned soap and water or an alcohol-based hand sanitizer. The goal of hand washing and hand hygiene is to remove as many microorganisms from the hands as possible to avoid transmission. A study at a hospital tracked 10 million hand hygiene events and showed 9 out of 10 healthcare workers use only one squirt of the hand sanitizer from the wall dispenser. Well, that sounds reasonable to me, but guess what? It isn't. To correctly use a hand sanitizer, you should pump enough product on your hand so that it wets hands fully and provides 15 seconds of rubbing before drying. If hands dry before 15 seconds have passed, that means too little product was applied to properly clean them. So the combination of proper dose, meaning using enough product, and a 15-second wet time is critical in helping to prevent healthcare-associated infections. Let's talk about the infection cycle amongst healthcare workers and follow the path. Here's the cycle. Microorganisms are on the patient's skin or nearby objects such as the bedside table. These microorganisms get transferred to the hands of the healthcare worker. The healthcare worker must either not perform correct hand hygiene or do it incorrectly. And lastly, the healthcare worker's contaminated hands come into direct contact with either another patient or an object, such as a shared blood pressure cuff or other such monitors and equipment. This is called cross-contamination. Well, now let's talk about a hospital patient. I saw this firsthand. No pun intended. When my mom was confined to her hospital bed for 4 months, the only time anyone wiped her hands was during the daily bath. No one came in before mealtime to ensure that her hands were clean. So I think it's fairly safe to say that the hands of patients are neglected while in a healthcare facility. Therefore, the patient's hands can not only contaminate the patient, but can transmit bacteria onto hands or clothing of the healthcare providers, who then transfer the bacteria to the next patient. And also, notice where the hand sanitizer is located within a hospital room. Just one, on the wall, next to the door. Many patients are immobile or sedated or at a risk for a fall. Can they really be expected to jump out of bed to sanitize their hands? Well, here's an obvious case for bringing hand sanitizer with you to the hospital or asking for some and keeping it on your nightstand or tray table. And by the way, guests and visitors should always use the hand sanitizer before and after touching the patient. And if your patient is out of it, routinely glob the gel onto their hands and clean the patient's hands for them. Soap and water is still considered the gold standard for hand hygiene. But when soap and water is not available, these alcohol-based hand rubs or gels or foams should be used. This is so easy to do, but here's the problem. The average person washes their hands for around 9 seconds, and only 16% wash their hands for the recommended time. And washroom studies from around the world show that less than 80% of people wash their hands at all, which means that 1 in every 5 of your coworkers is walking around with unwashed hands. Speaking of coworkers, here's some more thoughts about the workplace. Researchers found that sick people go to work rather than calling in sick. 83% of the participants in the survey said they continued to attend work or school while experiencing symptoms of an influenza-like illness. And as odd as it sounds, coming to work sick and not working up to par costs employers twice as much than if the employee stayed home due to poor work productivity. For every employee who comes to work sick, up to 18% of their colleagues will become infected as a result due to poor hand hygiene. Why is that? Well, according to one of our previous guests, Dr. Chuck Gerba, a microbiologist from the University of Arizona, he says desktop surfaces, computer keyboards, mouse and telephone receivers are more contaminated than restroom toilet seats. While there's not much you can do about healthcare providers routinely washing their hands, you can ask them to wash before touching you. And if that is a problem, you can hand them one of my icebreaker cards designed specifically for the shy patient. When a doctor or nurse enters your room without washing or sanitizing their hands, simply smile and hand them this card that says, "I am concerned about healthcare-acquired infections. Please wash your hands before touching me." It works, folks. I used it on several occasions, and it generates a pleasant conversation and quietly gets the provider to wash in front of you. And for employers and employees of non-hospital-related businesses, here's my suggestion. Businesses need to focus on infection prevention rather than managing and paying for absenteeism due to preventable actions. Even a small reduction in colds and flu would have a huge impact on reducing costs, both to the employer and the employee. So if you'd like for me to come to your workplace to quickly enlighten your employees about germy working hiding places that will ultimately save the company and employee thousands of dollars in unnecessary health costs, contact me now. Just email me at at speakupandstayalive.com or call me at 440-725-5462. And in the meantime, go wash your hands. And with that out of the way, let's hear some legal news that you can use. Last week, I met with Allison Mance McMeechan, an attorney at the law office of Schraff and King on Somme Center Road in Willoughby, Ohio. If you've listened to this show, you know I'm a big believer in advanced planning of all kinds, but especially when it comes to health care, financial, and other legal matters. Listen as I spend 2 minutes with Allison. Allison, we have so many people that ask us questions about living wills. What is a living will and why do I need one?
A living will is a statement of your intention with respect to end-of-life care. A living will declaration would indicate that you do not wish to have artificial measures taken to prolong your life in the event that you are either permanently unconscious or terminally ill. It instead asks that you receive comfort care only during those times. If you know that that is your wish, I would recommend that you do consider executing a living will, as it takes a lot of the pressure off of your family members during such a difficult time, and instead allows your wishes to be carried out when it comes to end of life.
What would happen if somebody did not have a living will? Who makes those kind of decisions for them?
There is a law that sets forth what happens in the event that someone is either determined to be permanently unconscious or terminally ill in the opinion of two physicians. It does provide that if certain family members consent to the withdrawal or withholding of artificial measures, then the physician can follow the orders of the family. That order includes the first person would be a legally appointed guardian, the next would be a spouse, the third down the line would be children. If there's more than one child, then the majority of the children, and then parents. And if there is no one, there is a measure by which a physician can petition to have the person determined to be permanently unconscious or terminally ill and have the withdrawal or withholding of artificially supplied nutrition and hydration.
And how does a person go about drafting a living will?
You can see an attorney for the preparation of a living will. There are also pre-printed forms that are put together through the Ohio State Bar Association, Ohio Medical Association, and Ohio Hospice and Palliative Care that do have a standard living will that can be found on the internet.
But to be sure that it says exactly what you want it to say and have it do what you want it to do, it might be advisable to work with an attorney on that.
Yes, there are also specific execution requirements, so you want to be sure that the document is executed properly so that your wishes are carried out.
Well, thank you so much, Allison. How can our listeners find out more about you and Schraff and King?
Thank you, Pat. You can contact us at 440-585-1600. You can also visit our website at www.schraffking.com.
Thank you for visiting with us today. I'm sure we will have many more questions of you in the future. Thanks, Allison.
Thank you.
If you do nothing else today, give Allison and the folks at Schraff and King a call to review or create your own plan of action. No one plans to fail. They simply fail to plan.
Generation America supports Speak Up and Stay Alive Radio. Generation America, the smart, conservative, and traditional 50-plus membership organization. Generation America cares what their members think about the issues affecting seniors and ensure their voices are heard. And they provide a full range of benefits to members. If you're looking for quality Medicare supplement, their rates are lower than the other 50-plus organization 3 out of 4 times. Generation America, on the right side for seniors. To join and to find out more, visit generationamerica.org.
After the show, be sure to visit the website, speakupandstayalive.com, for more life-saving information. Purchase the book that thousands of folks like you have already read. It's called Speak Up and Stay Alive. I wrote it after dreadful personal experiences, 4 years of research, and the desire to help others avoid what I witnessed. Take the book to the hospital with you. Lay it on your bedside table. Just from the cover alone, it is guaranteed to start a conversation with your healthcare providers, and that's important. Let everyone know that you are concerned about hospital safety and infections. You'll no longer be the knee surgery in room 202 or the heart attack in room 301. You will be viewed as an informed and empowered patient. You'll stand out, and that's what you want. Without saying a word, your doctors and nurses will know that you are special. Before a hospital stay pops up unexpectedly in your life, you can purchase the book, Speak Up and Stay Alive, The Patient Advocate Hospital Survival Guide. It's found exclusively at the website, speakupandstayalive.com, or it's available in person at all of our speaking events. Buy one for yourself, send one to your future advocate, and keep another handy to give to your doctor, and give them away to family and friends. What a special and highly useful gift idea. And to help your entire group, organization, business, or church stay safe during any healthcare or hospital experience, invite me to speak. Our presentations are lively, interactive, fast-paced, and about as fun as hospital safety can be. Email us at speakupandstayalive.com or call 440-725-5462. And now, back to the show. To help you survive the healthcare mandates that are coming down the pike, you need to know about them. Who will suffer higher health insurance premiums or experience fewer choices between doctors and medical plans? What about ration care for all, especially seniors? Fortunately, there is a resource, an alternative that is fighting to restore the American dream, and that is Generation America. Listen as I spend the next minutes with Russ Richmond of Generation America. Welcome to the show, Russ.
Thank you.
Russ, tell us, who is Generation America?
Generation America is a 50-plus member organization that was founded in 2009. The founder wanted to start an organization that was really looking out for the well-being of seniors. He was an AARP member, and when they came out in favor of the Patient Protection and Affordable Care Act, which has had significant cuts in Medicare, he was very upset and felt like that someone needed to come out there and really represent seniors and speak up for them. Not many people know it, actually, but 93% of the phone calls that AARP was receiving during that time were against their support of AARP, and yet they continued their efforts to work with the White House to get the law passed.
Tell us, how is Generation America different from AARP or other 50-plus organizations that are popping up?
Yes, well, there are a number of differences. First, Generation America does offer many of the same types of benefits that other organizations offer, although some don't offer any benefits at all. And one of the things that really sets us apart is that we are not a licensed insurance company, as AARP is, nor are we owned by an insurance agent, which a couple of the other senior organizations are. And what really drives it home is that on all of our insurance benefits, we offer what's known in the industry as an aggregated platform. That is, there are many different top-rated carriers to choose from, so you can evaluate coverages and rates and really pick the carrier that is best for you. And we have many testimonials from members saving hundreds of thousands of dollars a year as a result of how we have set up our member benefits.
So in other words, people do have a choice.
People have a choice. I mean, one of the big ones is Medicare Supplement, which is really key now for many seniors, with 10,000 of them turning 65 every day, which is a pretty staggering number. Again, we offer an aggregated platform through our partner, and they've done all the analysis, and 3 out of 4 times the rates that they offer are lower than what United Healthcare and AARP are offering. So again, it's giving them a choice. And the nice thing is, and I'm insured through them, I had a choice of 10 different carriers. Different carriers have different histories with how they handle rates from year over year and the service that they offer their members. The benefits themselves are all prescribed by the federal government, so exactly what you receive is exactly the same. So it's really just comparing companies and their rates.
So if our listeners want to explore the Medicare supplement plans that you offer, how do they go about doing that?
Well, the easiest thing to do, and we do not require that you be a member even to take advantage of it, because our whole mantra here is the safety, security, and well-being of seniors. So all they have to do is call our partner and it's a toll-free number. It's 855-772-3633.
Great. And tell us a little about the lobbying that you do on behalf of seniors.
Yeah, well, that's an interesting word you use. We actually do not use any lobbyists, and I would say that we don't do any lobbying. Most of the lobbyists are looking for people to give them millions of dollars and for them to go grease a politician. What we founded this company on is really getting our members' voices heard. So we do monthly surveys on issues that are important to seniors either directly or issues that they're really concerned about in terms of the country and the direction it's going. And we take those survey results and get their voice heard in Washington. We just finished a survey, and we've sent it to all the leadership in both houses, the White House, and we sent out a press release, and I was just looking at the results of that a few minutes ago, and from the first 3 days of the release, we've already reached over 60 million people. So our goal is to get their voices heard and to get it in the discussion.
Tell us about the Medicare Advantage disenrollment period. What is that, and what do our listeners need to know about this?
Wow, that's a great question. A lot of people don't even know that this exists and that they have this option and why it's important right now. There's an annual Medicare Advantage disenrollment period that starts January 1 and ends February 15th. And during that period, you have the option of getting out of Advantage and getting into a traditional Medicare supplement program. And why this is important is that everyone's heard about all the funding that has been taken out of Medicare, and a little over $300 million of that total has been taken out of Medicare Advantage. And the Congressional Budget Office and the House Committee on Ways and Means has estimated that over the next 5 years, about half the people who currently have Advantage are going to be getting out because of cuts in benefits and rapidly increasing costs. They're estimating that by 2017, within 5 years, that the rate for Advantage will be $3,400 a year, which is more than most, I'll say, of the current Medicare supplement program. So, if you're in good health and you can afford it, Medicare Advantage probably isn't the best place for you to be staying very long, and that whole enrollment period is going to be changing in 2013.
Well, how can our listeners find out more about this Medicare Advantage disenrollment period, and how can they take part in the plans that you offer?
Talking to our Medicare supplement partner is the answer to that, and that phone number is 855-772-3633.
How can we find out more about Generation America, and how can our listeners join?
Well, the best place is generationamerica.org, and right at the top of the page, you'll see our spokesman, Chuck Woolery, and there's a Join Now button, and we offer 1, 3, and 5-year memberships, with the 5-year membership being the lowest annual cost. You're a member instantly when you join, and you're given access to the member areas, and you will get your voice heard, and you'll be able to take advantage of all these fantastic benefits that members have access to.
Well, thank you, Russ, for joining us today. We look forward to your return next week.
Thank you very much. It's been a pleasure, and as we say here at Generation America, we're on the right side for seniors, and we get up every single day to do everything we can to help add to their safety, security, and well-being.
And we appreciate that. And if our listeners have questions for Russ, contact me directly, and we may answer your question on the show.
Terrific.
interrupt our program to bring you a special broadcast.
Let's spend the next 2 minutes with our resident cleaning and infection preventionist, Darrel Hicks, consultant and author of the book, Infection Prevention for Dummies. Welcome to the show, Darrel.
Good to be here, Pat.
Darrel, what does it mean to clean green?
Green cleaning is one of the new waves, and people are more and more interested in the chemicals that they're exposing themselves and their families to. So cautionary statement on that is beware of those who call themselves green but have no third-party registration. You know, there's the green seal and a couple of others that will verify that the ingredients in that cleaner are safe and won't cause harm to humans or animals or water if it was poured down the drain. Green cleaning is using not just the chemicals, but the processes, and the way that we clean is using single cloth and never reaching in and dirtying the water with a dirty cloth. That is one of the examples of green cleaning, is that, you know, you are using the best products and the best processes in order to clean, that keeps you and those around you safe from some of the chemical allergies that are out there today. An example of something that is a green cleaner, pretty much just it by itself and water, is microfiber. There's the magic of microfiber, and just water will do the work that a regular cotton rag and some cleaners will do. So be wise, and you can order my book, and I have a whole section in the book, a whole chapter on the power of green cleaning. So that's an opportunity for you to learn more.
That's great information, especially about microfiber. Thank you, Darrel. How can we learn more about you and your book, Infection Prevention for Dummies?
My website is www.darrelhicks.com. That is Darrel, DARRELHICKS.com. You can find out how to get in touch with me or order the book there.
Well, thank you, Darrel. I encourage our listeners to check out your website and your book, and your blog has lots of excellent information. Thank you for being here today.
Thanks, Pat. It's been fun.
Would you like to be on the radio? Yes, you could be featured as a weekly guest expert on my show. I know that I am not the expert in all things, and I want to be sure that everything I share with our listeners is the best information available. So if you or someone you know has something of value to say that can help folks either stay safe, be smart, or make their lives a little easier or healthier, then contact me for all of the details. Email speak@speakupandstayalive.com or call 440-725-5462. You are listening to Speak Up and Stay Alive Radio. Now you can join us every Saturday morning on two Cleveland stations from 7 to 8 Eastern on AM1420 WHK and from 9 to 10 Eastern on AM1220 WHKW, and on Sundays in Phoenix, Arizona from 9 to 10 Mountain Time on AM960 KKNT, the Patriot, or listen to us live online from anywhere in the world at the station's websites. I am your hostess, Pat Rulo, so happy to spend this hour with you to help you survive any healthcare or hospital encounter. Today, Jeremy, one of our show producers, is back with us after last week's Squeak Up and Stay Alive game. You just couldn't stay away, could you, Jeremy?
I love it. I'm ready to go.
Well, welcome back to the show, Jeremy. So, did we get any emails this week?
We sure did. Here's one. Root from Ginger wrote, Pat, I attended one of your presentations last week, and I thought of a question. Can bacteria and viruses spread through a hospital's ventilation system?
Well, Jeremy, let me ask you, was that root for ginger, or was it ginger root?
It says root for ginger.
Root for ginger. All right, let's root for ginger. Ginger, you must be reading my mind. I've just had a very specific conversation with experts this week about the very topic that you mentioned. So within the next few weeks, I am going to have a guest on the show to answer your question. Unfortunately, though, it seems kind of obvious that this is a strong possibility. Any more, Jeremy?
Yes, Dick from Queen Valley asked, Pat, have you considered using PowerPoint during your presentations?
Well, yes, Dick, I have considered it, but quickly dismissed the idea. Personally, I hate PowerPoint presentations. When I go to an event and they dim the lights and then proceed to read the slides word for word, I just want to run out and scream. Boring. Dick, my presentations are fun, fast-paced, and filled with so much information, we couldn't advance the slides that quickly. But thanks for the suggestion. Any more, Jeremy?
Yeah, here's a good one that I am 100% behind. Jessie Girl wrote, Pat, I just love your new game of Squeak Up and Stay Alive. You, Bob, and Jeremy should go on TV.
Wow, Jessie Girl. Somehow the anonymity of radio allows us to behave much more weirdly than we might in person. Or maybe not. Bob's pretty nutso. What do you think, Jeremy?
I like it, yes. I love it.
Yay. Well, guys, I think that's a pretty good place to stop and head over to the game chamber. Last week, I was talking about the idea that as patients, we always have the right to ask questions and demand answers. And I referred to the saying, remember, the squeaky wheel gets the grease. And Bob said he hadn't heard of that saying. Well, the squeaky wheel that gets the grease is an old saying used to convey the idea that the most noticeable or loudest problems are the ones most likely to get attention and service. And we can easily transfer this idea to a hospital stay. So, for example, if you get a medication that doesn't look the same as the last medication, get squeaky, ask questions. And if you don't know why the nurses won't let you get out of bed, get squeaky and ask questions. So, having said all that, this is the great segue into our brand new game, destined to become everyone's favorite radio game of all time, Squeak Up and Stay Alive. Oh, yeah. If you thought our previous Fear the Wheelchair game was super fun, wait until we play this one. Here's how it goes. I will read a question from our squeaky question chamber. Bob and Jeremy will squeeze their squeaky toys when they think they know the answer. The first one to squeak gets the grease. Well, not exactly the grease, but they will get the chance to pick the next category of questions. With the hopes of winning the grand prize, the winner gets to keep their ice cream cone-shaped squeaky dog toy. Well, as last week, Bob has the chocolate one. Hey, Bobby, let's hear your squeak. Okay, and Jeremy has the vanilla cone. Let's hear yours. Oh, I love that one. And folks, these cones are so cool. They even have sprinkles in the shape of dog biscuits on them. Anyway. So are you radio rivals ready to play everyone's favorite new game, Squeak Up and Stay Alive?
Let's go for it.
I'm so ready.
Oh, my gosh. It's exciting to have exciting rivals. Here are the three categories. The first one is what we talked about on today's show. The second is healthcare-acquired infections. And the third are random rights. Jeremy won the pregame toss, so he begins. And to avoid a tie like last week, we will have an odd number of questions today. So what category do you want to start out with, Jeremy?
I am going to start with what we talked about on today's show.
All right. Here's the Squeak Up and Stay Alive question number 1. To be effective, hand sanitizer should stay wet on your hands for how long? Ooh, that's Jeremy. What's the answer?
That is 15 seconds.
Yes, that is correct. Remember, you need more than one squirt of gel. Cover your hands with enough product to stay wet for 15 seconds and rub, rub, rub. Okay, Jeremy gets the first point. What category, Jeremy?
All right, I'm feeling hot, so I'm sticking with the same topic. What's on today's show?
All right, the Squeak Up and Stay Alive question number 2. The slimy film that forms around faucet handles and drains is called... Oh, that's Bob's. What's the answer, Bobby?
It's biofilm.
Yes, our infection prevention expert, Darrel Hicks, said to get rid of that biofilm, you must scrub it off, perhaps with a toothbrush, because disinfectants cannot penetrate that film on its own. So, folks, stock your cleaning bucket with some dollar store toothbrushes and get rid of that biofilm. All righty. Bob gets a point and gets to choose the next category. What do you want, Bubby?
Let's try random rights.
All right. let's pull question number 3 from the squeaky question chamber. And it is a true or false question. As a patient, you do not have the right to receive copies of your test results. Oh my, I can't tell who squeaked first. All right, we're going to have a squeak off. All right, I'll count to 3 and the first squeaker gets to answer. Ready? 1, 2, 3. I think it was Jeremy.
Yes. Okay, I am saying that is false.
Yes, of course that is false, wrong, and so not true. As a patient, you not only have the right to receive a copy of all test results, it quite simply should be mandatory. How can you manage your health if you haven't even seen the results of your test? Plus, it just makes good sense to keep a file of all tests and their results as a historical documentation. It's so easy to forget what x-rays or blood tests we took 3 years ago or even 3 weeks ago. It just might save you from duplicate testing. Plus, as a bonus, you can cross-check when you receive the bill just to make sure you don't get incorrect or duplicate bills. Well, that means that Jeremy still controls the category. What do you want, Jeremy?
Okay, let's switch it up a little bit to healthcare-acquired infections.
All right, you're getting dangerous here. All right, the squeak up and stay alive. Question number 4. When a healthcare worker does not wash hands properly and touches one patient after another, this can occur. That's Bobby Squeaker. What's the answer, Bob?
It's called cross-contamination.
Yes, it is. And it's easy to see how cross-contamination happens. And it happens not only in a hospital, but in doctors' offices and out in the real world. Think of the deli clerk, restaurants, and think of healthcare workers wearing their scrubs in and out of the hospital. Yuck. All right, Bobby, you control the category. What do you want?
Let's stay with healthcare-acquired infections.
All right. The squeak up and stay alive question number 5. MRSA is a superbug bacteria that can result in a staph infection and is resistant to what? Was that Jeremy?
I hope that was. I think that was me.
Okay, what's the answer, Jeremy?
MRSA is resistant to antibiotics.
Yes, and do either of you know why?
Because people take so many antibiotics, I think. Is that correct?
That's the absolute correct answer, Bobby, because people, it's Jeremy's point, so don't get excited, because people overuse antibiotics and doctors overprescribe antibiotics to the point that the bacteria becomes immune and therefore the antibiotics don't work. Please, folks, do not let anyone prescribe antibiotics unless you know that you have a bacterial infection. Antibiotics do not work against viruses. All right, so Jeremy does get that point and chooses the next category.
Let's go back to today's show.
All right, feeling safe. The Speak Up and Stay Alive question number 6. It's another true or false. Married couples can access their spouse's financial documents and information such as individually owned accounts, life insurance, or stocks. Okay, Jeremy, you're hot on the trail. What's your answer?
That sounds like it should be true.
Jeremy, it does sound like it should be true, but you cannot access these types of individually owned accounts just because you're married. That is why it is important to have a properly drafted financial power of attorney. So it is extremely important, folks, take care of these types of issues now before the needs arise. Well, that's a game changer. The score is 3-2 in favor of Jeremy, and now Bob gets to choose the category.
Let's go with random rights.
All right. Is strategy involved with that decision, Bobby?
Probably.
Okay, we will see. Get your squeakers ready, you radio rivals, because here is the deciding question. The Squeak Up and Stay Alive question number 7. When patients undergo a procedure, surgery, test, take a new drug, or do anything outside of the scope of a normal visit with their physician, they are supposed to receive something known as... Oh, Jeremy.
Oh, I hope this is right. Informed consent?
It is right. Yes, we talked about this today with our guest, Doug Wojcicki. During informed consent, the doctor is supposed to tell you everything that can go potentially wrong, such as known complications. But the trouble is that informed consent doesn't always happen, or if it does occur, the quality of the decision is often poor or lacking, or the patient isn't paying attention or doesn't understand. during this time of informed consent, it is imperative to have someone else with you to make sure that everyone is on the same page. Well, let's add up the score. Jeremy, you are this week's winner with a score of 4-2. Do you have anything to say about that?
You know, I like this championship belt. It's looking pretty good right now.
What about that championship chocolate chip cookie we brought?
Oh, that was delicious. That was devoured, by the way.
See, I kind of guessed you were going to be the winner. And you also get to keep the squeaky ice cream cone squeaker until next week. But really, you're both winners, because think of how much more you know about being a safe patient. And our listeners are winners, too. Well, thank you guys for playing our brand new exciting game of Squeak Up and Stay Alive. Let's give ourselves a round of squeaks. Remember, the point of this game is the squeaky wheel gets the grease, or in this case, the squeaker gets the prize. So feel free to squeak up or speak up at every doctor's visit or hospital visit. That's the best and the only way to get the attention and service you deserve. Coming up, more of what you've come to expect from America's favorite healthcare and hospital survival radio show, Speak Up and Stay Alive. Oh, we have a live segue. This is Pat Rulo, Speak Up and Stay Alive Radio, and I have a very good-looking group of women with me and one very handsome man. And they want to announce this segment today. All right, are we all ready? Real loud in your best radio voice, we're going to announce the next segment. Ready?
Speak up.
Speak Up and Stay Alive Radio. Oh, come on, guys. You could do better than that. That was really lackluster. Let's try again.
Here's Speak Up and Stay Alive Radio for you. We didn't do very well. No.
Let's try it again. Here's a Speak Up and Stay Alive O for you.
Here's a Speak Up and Stay Alive O for you.
Oh my, that was like herding cats. Ooh, that in itself was quite an oh moment. Today we're going to introduce Speak Up and Stay Alive Radio Theater. Listen and then decide what type of doctor-patient interaction you would prefer. This is Healthcare Safety Out Loud.
Skit 1, The Demanding Doctor and the Polite Patient.
Here's the scene. A nervous-looking woman named Polite Patient Patty is sitting in the doctor's office, passively waiting for her doctor. Demanding Dr. Joe comes in and looks at his clipboard.
Hello, Miss Patty. I'm sorry I'm late. We had an emergency this morning and everything is backed up here at the really busy clinic. How can I help you?
Well, Dr. Joe, I'm just here for my routine exam.
Are you having any trouble?
Not really. I feel pretty good.
I see the nurse got your vital signs. They look good. I know you have diabetes. Have you been keeping up with your blood tests?
You mean the ones I take every day?
Yes.
Oh, sure. They seem fine.
Oh, just a second. Hello? I'm with a patient right now. I'll call you back, okay? All right. Bye. All right, no worries then. Are you staying away from sweets?
Oh, of course. I'm doing great.
Okay, we need to get your blood work, so stop by the lab. We'll see you in 6 months.
Phew, got through that. I think I need to treat myself to a little candy.
Have any of you ever had a doctor's visit something like that one? Well, we're going to bring back one of our actors and show you how patients can actually be a partner with their physician to get better quality health care.
Skit 2, The Diligent Doctor and the Prepared Patient.
Here's the scene. Our prepared patient Patty is sitting in the doctor's exam room looking prepared and reviewing her notes while waiting for the doctor. She brought Bob along to act as her advocate, an extra set of eyes and ears. Diligent Dr. Joe comes in and looks at them with a smile.
Hello, Miss Patty. I'm sorry I'm late. We had an emergency this morning. I know you're here for your diabetes checkup, and I want to make sure you have all your answers and concerns covered.
Thank you, Dr. Joe. I've been doing some research about diabetes, and I have a few questions. I also brought in all my medicines and vitamins so we can go through them. And this diabetes care sheet you gave me the last time says I should have you look at this at each visit.
That sounds wonderful. I'm glad you're doing some research and bringing in your medications. That's really helpful. When did you start taking glucophage?
Well, I had to visit a specialist, and she prescribed it.
I'm glad you brought this list in because it's important that I know all the medicines you take, prescription, over-the-counter, or herbal, to avoid any unsafe interactions for you. Let's get started on your list of questions. I see the nurses have already taken your blood pressure and weight. I also see we gave you a urine test, cholesterol test, and the blood glucose test. Let me also check your mouth and feet. Patty, your test results look great, and my visual exam indicates that you're doing a great job of managing your illness.
Remember to ask for a copy of your test results before you leave, Pat, for your files.
That's not a problem. We can give you printouts before you leave today.
I also have another question. What's the one thing I can do better to manage my diabetes?
Well, it's still important for you to lose a few pounds. Tell me what behavior changes you think are responsible for you to make.
Well, I've started walking with Bob once a week. He's trying to lose weight, too, so I bet he'd go with me 3 times a week. I could also cut down on the Sonic burgers I eat.
Those both sound like great ideas. Before you leave, will you talk with Mary, my assistant, to be sure we have your next labs and visit scheduled? When you come back, you can tell me how you're doing with the walking program.
Now this shows us how patients can partner with their physician to get better quality care. Like Patty in the last skit, how could you come better prepared to your next appointment? This assumes that your doctor is diligent and not demanding. As you've just heard, we can see that Polite Patty offered 0 questions and consistently told her doctor that everything was great. Prepared Patty, on the other hand, brought an advocate with her as well as all of her medications and supplements for the doctor to review. She had a written list of questions. She talked about research she had done. Bob remembered to ask for copies of her test results. And Patty initiated a very open-ended question. What's the one thing I can do better at managing my problem? Granted, the doctor's approach within the 2 skits were quite different. However, that should never scare or deter us from taking an active role during every doctor visit. It is our right, and it is our responsibility.
This is just another O moment from Speak Up and Stay Alive Radio. And if you want to announce next week's O moment, just call me, 440-725-5462, or email speak@speakupandstayalive.com. Well, today we learned about the simple but oh so important reasons why hand washing can keep us infection-free. And I hope you enjoyed our new game, Squeak Up and Stay Alive. Hey, when you talk about healthcare and hospital safety every day like we do, you've got to let off a little steam and get a little bit crazy. So if you missed some of today's show, you are living on the edge. Or if you simply want to replay it for yourself or a friend in need, go to the radio link at the speakupandstayalive.com website to listen to today's program. You might want to do that anyway, just to help you remember more of today's revealing information. Some folks I know are throwing Speak Up and Stay Alive radio coffee hours within their organizations. So start your weekend with an O, Speak Up and Stay Alive Radio. And listen next week as we continue to entertain while still sharing very important life-saving tips and tools to help you and your loved ones stay safe during any healthcare or hospital encounter. And send us your questions or comments on any topic pertaining to healthcare and hospital safety, and we will read or answer them next week. That's next Saturday morning, where you can find us in Cleveland, Ohio, from 7 to 8 Eastern on AM1420 WHK, and from 9 to 10 Eastern on AM1220 WHKW. Or listen live via the internet. Check the speakupandstayalive.com website to find out how. In the meantime, I hope you have a happy and healthy week. I am Pat Rouleau, and I am your guide to safe and successful healthcare and hospital encounters.
The information provided in today's broadcast is for informational purposes only and was not intended for use as diagnosis or treatment of a health problem or as a substitute for consulting a licensed medical professional. Participating as a program listener, guest, or caller should not be considered medical advice. References to any entity, product, service, website, or source of information should not be considered as an endorsement. If you missed part of today's show or just want to share the information with friends, you can download a copy of the show at speakupandstayalive.com. That's speakupandstayalive.com. Want even more information? Purchase a copy of Pat's book at the Speak Up and Stay Alive website. Once again, it's speakupandstayalive.com.
This is Pat Rulo. When you get a chance, become a friend and like us on Facebook. We're called Speak Up and Stay Alive. Then post your questions and comments on our Facebook wall. We may read them next week. Who else do you know who can benefit from this life-saving information? You can keep your group, club, business, or church safe from hospital hazards. I speak live and in person, too. Our events are fun, fast-paced, interactive, and jam-packed with serious information. Your crowd will love it. Just email me at speak@speakupandstayalive.com or call 440-725-5462. Until next week, remember to ask others to wash their hands. You have to speak up and stay alive. Call me, email me.
Survive.
Thank you. Thank you very much. Thank you. Thank you. Thank you.
Generation America supports Speak Up and Stay Alive Radio. Generation America, the smart, conservative, and traditional 50-plus membership organization. Generation America cares what their members think about the issues affecting seniors and ensure their voices are heard. And they provide a full range of benefits to members. If you're looking for quality Medicare supplement, their rates are lower than the other 50-plus organization 3 out of 4 times. Generation America, on the right side for seniors. To join and to find out more, visit generationamerica.org.